Hi, so as you probably know, less than a year ago, the COVID-19 virus was reported to the World Health Organization, and according to the CDC, nearly 300,000 people in the United States have died as a result of this disease. The Pfizer-BioNTech vaccine has been created, tested, and approved in less than a year, which is impressive because it's a much shorter timeline than other vaccines. However, in the wake of this vaccine's approval, many people are still hesitant to take it, so I thought I'd try to share some information regarding the first vaccine to be approved by the FDA, which is the Pfizer-BioNTech vaccine. According to the briefing document that was sponsored by Pfizer and presented to the FDA on December 10th, the Pfizer-BioNTech vaccine works, basically, by exposing cells in the body to a protein that's also in the spike of the coronavirus, which causes the body to create virus-neutralizing antibodies. Once these antibodies are created, they can help prevent the COVID-19 virus from infecting the body. The vaccine consists of 2 doses administered 21 days apart. Data from Pfizer suggests partial immunity after the first dose, but confirms more complete immunity after the second dose. In the FDA's briefing document for the meeting on December 10th, the Pfizer vaccine was, on average, 95% effective, with possible true vaccine efficacies ranging from 89.9% to 97.5%. Throughout the Pfizer briefing, there were, quote, no clinically meaningful differences in demographic characteristics by subgroups, including age, sex, and race or ethnicity, end quote. There were over 20,000 people given the vaccine and monitored in Pfizer's trial group, which, arguably, isn't enough to represent the population as a whole. However, it was enough for FDA's Vaccine Advisory Committee to advise that the vaccine be approved in a 17-4 vote. According to the Washington Post article titled FDA Says It Will Rapidly Work Towards Authorization of Pfizer-BioNTech Coronavirus Vaccine, published on December 11th, at least 2 of the panel members who disapproved mainly objected that 16 and 17-year-olds be included because of how few had been tested in the trial and would have approved the vaccine for those 18 and up. The vaccine had also been approved in Britain, Canada, Saudi Arabia, and Bahrain, meaning that there are many other teams and committees who believe that this vaccine is safe and effective. The data presented by Pfizer was also peer-reviewed in the New England Journal of Medicine, which stated that, quote, a 2-dose regimen of BNT162b2 conferred 95% protection against COVID-19 in persons 16 years of age or older. Safety over a median of 2 months was similar to that of other viral vaccines, end quote. According to the FDA briefing document for the meeting on December 10th, the Pfizer vaccine did have some mild to moderate side effects, the most common including pain at the injection site, fatigue, headaches, chills, and muscle pain. These side effects were more prevalent in people under 55, with milder and less common symptoms in people over 55. These side effects took around 0 to 2 days to appear and lasted, on average, 1 to 2 days. It's vital that as many people as are able take this vaccine in order to promote herd immunity. Even though getting the vaccine protects the individual, if a high enough percentage of society takes the vaccine, it helps to protect those who are unable to take the vaccine through herd immunity. According to the article entitled Herd Immunity: Understanding COVID-19, published in the Immunity Journal, herd immunity can be created by around 70% of society being exposed to the coronavirus, either through a vaccine or directly. However, the article states, quote, the consequences of the latter are serious and far-reaching. A large fraction of the human population would need to become infected with the virus and millions would succumb to it. The best and safest way to create herd immunity and ultimately help life return to normal is to take the vaccine as soon as it becomes available to you, to protect not only yourself, but anyone else you care about. We will learn more about the vaccine as time passes and it's administered to more people, but scientists have widely agreed that this vaccine is safe and effective and that its benefits far outweigh the risks. Even though it was developed quickly, it still had to undergo a rigorous review process, and it was approved. And even though there was pressure from President Trump to approve the vaccine quickly, it's widely agreed that the vaccine would have been officially approved regardless. The Pfizer vaccine has been approved as safe and effective by multiple unbiased groups of scientists, and many politicians, including the current President of the United States, Trump, and President-elect Biden, are in favor of the vaccine. And the vaccine is widely agreed upon as the safest and quickest way to end this pandemic. So I strongly encourage you to be a part of the solution to save lives and end this pandemic safely and quickly through taking a vaccine as soon as it becomes available. Thank you for listening, and have a great day. Also, I will link my bibliography in whatever is down below. So, thank you.